Hi, my name is Charlotte, and I'm a breast cancer survivor. In a series of short videos, I'm sharing my breast cancer journey with you. If you missed the first video, I'll leave a link so that you can go back and view it. Okay, during my initial appointment in October with the patient advocate, she discussed several surgery and reconstruction options for me to consider, such as single or double mastectomy and implant or DIEP reconstruction surgeries. After reading through the information that she had provided, I prayed about it and discussed it with my family, and then I decided that I would go with a double mastectomy and a DIEP reconstruction surgery. She also suggested that I take someone to all of my upcoming appointments that would help me keep my schedule straight and would help me with all the information that I was receiving, because it could and would sometimes be overwhelming. Now, when the oncologist's office called me to schedule my appointment, they told me to be sure to bring all my medications, any vitamins or supplements that I was taking, as the doctor would need to know everything that I was using in order to give me proper directions before and during my chemotherapy treatments. Now, my initial meeting with the oncology specialist was on Monday, November 6th, and I had asked my daughter to come with me for support. I love my daughter dearly. That's my baby girl. And even though the final decision would be up to me, I wanted her to be on board and to have her full support, because I didn't need the stress of having conflict with her about my decisions while I was going through the situation. When the doctor began to explain my diagnosis and indicated his course of treatment, which would be 6 rounds of chemotherapy that would begin on the following Friday, November 17th, she both questioned and challenged his decisions. She asked him, why would I need chemotherapy if I was going to have a double mastectomy? He simply explained to her that having the surgery to remove the tissue would not be enough, because I needed to have the chemo to kill the cancer cells. My daughter was protectively defensive and felt like there were other avenues that I should be able to take. Now, I'm sure he had been in this situation many times before, and I felt like he was very patient with her questions, and her concerns. However, he did not waver his proposed course of treatment for me. At that time, we also discussed my preference of receiving chemotherapy, whether it would be through my veins or through a port that would be placed in my chest. I opted for the port because my veins are thin and sometimes hard to find. And I don't know if you can see, but this is my little souvenir from my port. He also asked about whether I was taking other medications, vitamins and minerals, or other natural supplements. I told him I was not taking vitamins. I did tell him about my asthma inhalers, and I let him know that I was taking Ganoderma supplements, drinking Ganoderma coffee, as well as wheatgrass. And I also showed him a bottle of mineral supplements that I had just started taking for my hair. He told me I could continue on the wheatgrass, but he would prefer if I stopped taking everything else, because it could adversely affect the effectiveness of the chemotherapy drugs and prevent them from doing their job. He also went on to say basically that the vitamins and supplements would feed the cancer, and I didn't want that, so I was willing to comply with what he told me. After my daughter and I left this appointment, she stressed the fact that she was totally against chemotherapy, as the drugs were only poison and they could damage my vital organs. She didn't care for the doctor, and that I needed to get a second opinion. I told her simply that based on the fact that my breast cancer was an aggressive form of cancer, I felt like a second opinion at that time was not an option, and I was confident that the oncologist was giving me the right course of treatment. Now, like I said earlier, I love my baby girl, and I deeply wanted her to be on board. So rather than go back and forth with her, I began to talk to the only person that I knew who could get through to her. I began to talk to God. I told God that I knew that she wouldn't listen to me, and I needed him to cause her to hear someone so that she could understand. Later on that week, she called me in the evening when she got home from work, and she began to tell me that she was talking to one of her clients about my situation and how she felt about the surgery as well as the chemo. And her client told her, "Your mom is doing the right thing." Her client told her about a friend that she had that also had breast cancer, but she opted not to have chemotherapy, just a double mastectomy surgery. Later, her cancer came back and spread to her mouth, and then she told my daughter, "And I don't have to tell you that she's no longer with us. So your mom is doing the right thing by having the chemo to kill the cancer cells." Next came the battery of tests and procedures I would need to have before I began chemo. The surgery for my port was on Thursday, November 9th. The BRCA genetic test was on Friday, November 10th, and my MRI was on Monday, November 13th. The teaching appointment with the teaching nurse was on Wednesday, November 15th. During this appointment, the nurse first went over each medication that would be a part of my chemo cocktail and told me all of the side effects. She also went over the other medications that I would need, some that I would have to take the day of chemo, the day after chemo, and any medications to help me deal with the side effects of the chemo, such as nausea, vomiting, and diarrhea. I asked my mom to go to this appointment with me. Now, my follow-up appointment with the oncologist was Thursday, November 16th. When I went back for my follow-up with him, all of my test results had come back. He told me immediately that the MRI showed no signs of cancer in any other part of my body, and that my BRCA gene test was negative, meaning that I did not have the breast cancer gene. That was all good news. As me and my family began discussing who would take me to my appointments and who would pick me up for my treatments, my daughter let everybody know that it didn't matter who took me to my appointments. She was going to be the one to pick me up and bring me home. And so on Friday, November 17th, I had my very first chemo infusion, which lasted 5 hours, and 6 pounds of fluid was pumped into my body to begin to fight those cancer cells. Now, let me say this. Sometimes it can be difficult to find people to be a part of this process with you. While they want to do it for you, they sometimes have a hard time dealing with your crisis, or just may have a difference of opinion as to what course of treatment they think you should take. Be sure to be open to listen to them, be patient with them, but be decisive. In my next video segment, I'll be sharing with you how I handled the effects of chemo while continuing to work, and also the great loss that me and my family suffered. If you enjoyed this video, be sure to hit the like button and subscribe if you want to know when the next video will be uploaded. Thanks for watching and listening.